So what's the deal with the different lab tests? I know some of you have heard that there's a rapid test, some of you have heard there's a blood test. So why do we keep doing the nasopharyngeal swab here? So the nasopharyngeal swab is that swab I talked about before, where they put it through your nose and reach all the way back into the back of your throat to your pharynx. They take a little, just a swab there, so just a little touch, and then they send that to the lab, who then tests to see if there's any genetic material of the virus left. So they're not actually looking for any live virus, they're just seeing if there's any genetic material. That helps it be quite sensitive, and it picks it up whether or not the virus has survived. And the downside is that it's a bit of a slower test. The test itself, once it's in the lab, it's been processed, and you've got a technician working on it, still takes 12 hours or so. So that on top of transporting it there, getting it all processed, the backlog because so many of you are going for testing, means you're not going to get your results super quick. And so people are being isolated while waiting for results, which is unfortunate, but this is a good test, and so we want to make sure that we're still getting the best results possible. The rapid test has not yet been approved by Health Canada, so we can't actually use it in Canada. That's issue number one. We need Health Canada approval because they need to test to see whether or not it's accurate. Is it picking up all of the cases that it should be? We don't want to miss any cases. And when it tells you that there's a positive, is it truly COVID? Because we don't want to be overcalling things and telling people they have COVID when in fact they have some other virus. So that's the first issue. The second is it's really probably not as good as the test that we're doing now. So while Health Canada hasn't approved it yet, we already have some data to show it's not quite as accurate as what we're doing. And the third thing is it can't do as many samples. So our lab is doing 600 samples a day these days, sometimes over 1,000 samples a day, and the rapid test just can't handle that sort of volume. So that's the rapid test. We don't have it. The other thing is a blood test. So how come we can't go for the blood test? So a blood test looks for antibodies. That is the response that your body creates when you have an infection. So it's the fighter cells that your body creates so that it recognizes infection and knows what to attack if that infection were to ever come again. So it's not looking for the bug itself, it's looking to see whether or not you responded to it, which means your body has to have responded, and that takes time. So it's not good at diagnosing you while you have the infection. It's much better at seeing if you have ever had the infection in the past. So it's very helpful for our surveillance to know how many people have been infected, but because it takes like a good 5 days of having an infection before you start to have those antibodies, we can't use it as a diagnostic test. So that's the deal around testing, but we're always looking at research, we're always expanding. So, maybe in the next video I'll be telling you something new about testing.